Hi, my name is Elizabeth Rimmer and I'm Clinical Director for LPA. I'm here today because I wanted to talk to you about good products to use for your skin at night. I facetiously called this live Cold Cream Anyone, and my focus is not cold cream, but I was just holding cold cream up as a kind of generic sort of, the thing that you see on the films, people slapping on their face before they go to bed. So that's the reason for that. I'm not going to be dwelling on cold cream itself. It's just a symbol. Okay, so cold cream, whilst we're on it, in case you're wondering, it is what we call an emulsion. It's a mixture of oil products and water. And it is used to moisturise, hydrate. It's also used, some people use it as a cleanser. And like I say, it's that kind of typical cream that you see splodged all over people's faces in films and TV stuff. So the reason I'm just kind of using it as a symbol is that my view is that beauty products in general, so these are the kind of products that you just buy over the counter, have a real focus on smell, texture, presentation and feel good factor. So presentation, I just mean like coming in a nice fancy box. So the more expensive the range you opt for, the better the smell, the better the texture, the fancier the box, and you put it on your skin and it gives you that instant, what I call feel good factor. So it feels really nice. And again, often it happens in shops all the time, and friends do it, but they open something up and they kind of go, oh, smell that. And it's, why is the smell important, really? If you're looking for something that's benefiting the skin, what is it, guys? Why is the smell important? But that for me would sum up a typical kind of beauty product. Focus is all on the feel good factor, not necessarily on any fantastic benefits that it's providing for your skin. So for me, I would say, and I have said previously on these lives before, that the godmother of all anti-aging ingredients is the retinols. So let's move that down there. So these are basically ingredients that are used in medical grade skincare, predominantly in night products, but you might get very small sprinklings in day products as well. And they are more and more being used in beauty products because the beauty industry has cottoned on to the fact that its customers are becoming a bit more discernible, and that actually some of them are after a bit more than the feel-good factor. So they are in some of the products that you can buy over the counter now, but there's lots of different variables. People will often focus on the percentage when they come and see me. They'll be telling me about the percentage of retinol in the product that they're using. But it's not always, unfortunately, as straightforward as that, because it has to do with the other ingredients, the way that things are mixed together, the actual container that it's kept in. So there's lots of different factors that will affect the potency of a retinol. And so even though at the time of packaging it's not a lie to say, it's 5% or whatever the percentage is, actually each product is not comparable, if you see what I mean. So it's not like for like. And what you will find as a rule generally is that your medical grade skincare are going to be more accurate, more predictable, and the ingredients that are contained with them are generally sort of more available. In other words, they work better. So as I said, sometimes people come in with extraordinarily high percentages of retinol in the creams that they're using, and I'm extremely confident that pretty much any of the products that I provide to them will be more potent. So it's a weird one, trying to sort of understand how that is, but it is. So retinoids, it's basically what we're talking about here is this ingredient vitamin A. And this is the kind of, as I said, the holy grail of anti-aging. If you want to keep your skin looking young, if you're 30 or over, and even for some under 30-year-olds, you know, we all age at a different rate. We all have different, you know, exposure to elements that will make us age. We've all got different genes. But if you're really interested in kind of keeping the texture, the tone of the skin looking good as you get older, then this is for you, basically. And there's various different terms that you will hear. So again, that makes it even more confusing. You've got retinol, retinoid, retinoic acid, tretinoin, lots of different terms just to make it nice and confusing for you. So why are they so good? Why do I love them so much? One of the most important factors with using these ingredients is that they will stimulate collagen. So they will make your body produce more collagen, and they will increase how quickly your skin cells renew themselves. Sorry. And that helps to improve the skin elasticity and the firmness and just the plumpness and make you look like you've got less fine lines. So that's a good one, right? Another thing that they can do is that they can assist with reducing irregular pigmentation. So pigmentation, again, fancy word for kind of dark patches on the skin. So depending on the severity of the problem, it might not be enough on its own. That's certainly something you'd need guidance with, but they can help with reducing pigmentation. And just generally refining the texture of the skin, leaving it a bit more smooth, just with that little bit more radiance than usual and a bit more of an even complexion. Another advantage is that they'll help to repair past sun damage. So that kind of links in with the previous one in a way. But yes, damage that's gone by, using a nice potent retinol product is going to help to kind of start undoing some of that damage. And another one that might not be as well known is that they can help to reduce oil production. And oil production will increase your risk of breakouts and enlarge the size of your pores as well. So benefits of reducing your oil production are, you know, improved pore size and also reduction in breakouts. So lots of very positive attributes when you're using something with these ingredients in them. So like I said, there are lots of different kind of preparations. There's a prescription strength vitamin A, which I use if somebody is on, you know, quite an aggressive anti-pigmentation, anti-aging, or even sometimes anti-acne treatment. I might use that as well if you come and see me for something like microneedling, because it just helps to kind of maximise the result that you get after the treatment. It's useful after peels, again just helping keeping the skin ticking over and keeping it renewing so it looks better and better. So it's something that you may need guidance on, or it may be better for you to get guidance. That doesn't always mean that I have to see you face to face, but in terms of kind of choosing the product that might kind of get the best out of your skin, it might be worth kind of dropping me a message if you're thinking about going down that pathway. Like I said, for me, I think anyone sort of 30 or over should definitely be considering using them. And if you've got, you know, a bathroom full of, you know, useless feel-good factor skin products, then when you're running out, just think about swapping that over for something that's going to do you a bit more good.